My name is Rutger Zietsma and I'm the CEO of Manus Neurodynamica. I'm going to introduce to you the Neuromotor Pen, a 21st century diagnostic for Parkinson's disease. First of all, I would like to tell you what this product is. Then I would like to tell you how it may be used in clinical practice, what its clinical utility is, and then I'm going to give you an update on a clinical trial that we have recently completed. And I will briefly summarize this at the end. So first of all, what is the Neuromotor Pen? The Neuromotor Pen is a digital biomarker for Parkinson's disease. It is the most accurate device for the quantification of fine motor skill, and the product has been clinically validated for the use in differential diagnosis. We've developed this very closely with the Northumbria NHS Foundation Trust under the leadership of Professor Richard Walker. So how may we use the device? Well, the patient is seated behind a table, holding the pen. The app installed on a tablet PC then presents a number of tasks that have been developed with clinicians, and the patient is simply tracing and copying some of these tasks that can be seen on the screen. Very simple to use, but underlying it is an innovative concept and a complex set of algorithms that provides the clinician with very important information about movement abnormalities that will help them in their clinical decision making. So its clinical utility, three different aspects, three different algorithms running on the machine. So first of all, the extraction of the digital biomarkers, then severity measurement for the purpose of monitoring, and also differential diagnostic decision making. A bit more detail on each three of these different functions. So digital biomarkers, these are used to quantify fine motor skill. There's a direct relationship between the physiology of the patient and the values of the biomarkers. And the level of detail that this gives is very much of interest to academic researchers and people working in the pharmaceutical industry, and sometimes to clinicians if they want to really find out what is going on with the patient in terms of his or her physiology. The digital biomarkers are presented in a way that are color-coded. So in the example here, we've got for three different tasks those half or semi-filled circles with a low value corresponding to a shade of green. This indicates a healthy subject, well able to move. And shades of orange or red indicate symptoms of Parkinson's. So that's the biomarkers. These biomarkers may be combined into a severity measurement score for the purpose of monitoring, and in particular bradykinesia and also tremor are very important because these map very nicely onto the Unified Parkinson's Disease Rating Scale. In addition, there are a few other measures that are important because they give some insight into how well the patient is able to deal with everyday tasks. And all of this will be recorded, digital record keeping, so that measurements can be compared over time. Here's an example. So we see the bradykinesia score and the tremor score with a value, and again a shade of green. So we're looking at somebody who is able to move very easily. And then we've got, for one patient, three different recordings, and we see that the values change over time. And the third and perhaps most exciting application is supporting differential diagnostic decision making. So providing the clinician with a probability that the patient is suffering from Parkinson's disease. And this has been validated recently in 132 patients, and it's important to notice that we've been looking only at the most difficult to diagnose patients. So approximately 25% of all newly referred patients will undergo DAT scan. 6 months after the DAT scan, the diagnosis was confirmed. We have compared our product with this gold standard, and we found that the sensitivity was 95% and the overall accuracy was 80%. So in summary, we've got a digital biomarker for the fine motor skill quantification. The intended use is both severity measurement, but also differential diagnostic decision making. And the accuracy of this device is 80%. It's very low cost, very convenient to use, and it may stream the overall clinical pathway. Thank you very much for your attention.